So today's topic is health policy, 5-year plan and NITI Aayog. So surprisingly, after India got independence, there was no such thing as a health policy until the year 1983. Just imagine, for 30 years there was no, almost 40 years, there was no health policy. The health policy came in the year 1983. So till then, there was no health policy. So 1983, for the first time, they said that the government should have a national health policy, and this was basically done as a result of the deliberations at the World Health Organization, which said that health for all by 2080. So this lays stress on the preventive, promotive, public health and rehabilitation. Okay. So this was the national health policy in 1983. So it's a pretty long stuff. So this was the reason the World Health Organization said that you should have the health policy. If you want to attain health for all by 2000, you have to have a national health policy. All countries. So this is the reason why the national health policy was started. And the key elements, what are the key elements? Create awareness of health problems in the community and means to solve the problems in the community itself. Second one was supply of safe drinking water and basic sanitation using technologies that people can afford. So what do I mean by safe drinking water and basic sanitation using technologies that people can afford? What do you mean by that? What basically is meant by that? You supply safe drinking water. Now what is safe drinking water? What is safe drinking water? What do you mean by safe drinking water? Safe drinking water means, what does it mean? No problem. You don't know what is safe drinking water. What is the meaning of safe? Safe drinking water? What is? Okay, water without contamination, water which is without this. So safe drinking water. So obviously, if you take water from a place which is not very hygienic, it is not safe drinking water. So the supply of water which is safe for consumption, human consumption, not for washing or anything. That is the first thing. Second one is basic sanitation using techniques that people can afford. So what is the technique? Now if you tell them to make a big, huge lot of sanitary latrines, it may not work. But using technology that can work, okay, that people can afford. And reduction of existing imbalance in the health services by concentrating more on rural health. Now, here, the majority of India's population still lives in the rural areas. Only 40% or so live in the urban areas. So most of the health things are focused on the urban areas. Hospitals, doctors, everything. So in the rural areas, there's nothing. Or less, actually. So for example, let me just ask you a question. How many of you are from an urban area? How many of you from an urban town? Urban town means district headquarters or a metropolis or a big city. How many of you are there? Lift your hands. 1, 2, 3, 4. Only 4 of you are. Okay. Only 4 of you are from there. How many of you would like to work in a big city? How many of you would like to work in a big city like Calcutta, Mumbai, Delhi, wherever else? How many of you would like to work in a big city? Be honest. Nobody wants to stay in a big city. Hey, only 1 person, 2. Only 2 people want to stay. All of you want to work in the rural area. Very good. So, if it's true, it's good. Because what are the problems in the rural area? What are the problems in the rural area? What are the problems in the rural area for work? Transport, electricity, there's no infrastructure, thaka jaga nahi, quarters nahi, all these things are there. So, but that's the reason why people are focused on urban areas. So, reduction of existing imbalance in health services by concentrating more on rural health. So, that was the thing in 1983. Establishment of dynamic health management system, information system to support health planning and health program implementation. Provision of legislative support to health protection and promotion. Concerned actions to combat widespread malnutrition. Research in alternative method of healthcare delivery and low-cost technology. Now the first one, Establishment of dynamic health information system. What do you mean by dynamic health information system? What is a health information system, for example? What is a health information system? Huh? What is a health information system? Health information system, what is it? What is a health information system? What is a health information system? Suppose the minister wants to find out, the health minister of India wants to find out the number of dengue cases in West Bengal. What will he do? What should he do? What will he do? What should he do? What will he do? If the health minister of India wants to find out the number of dengue cases in West Bengal, what will he do? What should he do? Check records. From where? Okay, yeah, check records, you're right, but he's sitting in Delhi. Check records may not be possible. So, basically, he will ask for the records, right? So, the record should be there. So, the record should be there, either written form or computerized or whatever. So, that is the basic thing, health information system. And that should be transmitted to the higher authorities whenever required. Okay. So, that is the first thing. So, in a district, if there are 50 dengue cases, that information should go to the state headquarters and so on. So, that is that supports health planning and health program implementation. Provision of legislative support to health protection and promotion. Can you give an example of that? Promotion of legislative support to health protection and promotion. Example, can you give an example of that? Can you give an example of support of legislative, provision of legislative support to health promotion and protection? Can you give an example of that? Legislative support manataki. What is the meaning of legislative support? What is the meaning of legislative support? What is the meaning of legislative support? Huh? What is the meaning? Bolo. Maybe we're wrong, no problem. Bolo. Legally support. Okay, legally support. Can you give an example of that? Legally support a health promotion or health protection campaign. Huh? Which is not there in Birbhum in a big way. But right now, in this very class, that is being there. That is there. I can give you a clue of that. In this very class, that thing is there. Somebody has used that legislative support part in this very class, but this generally is not followed in Birbhum, in Bolpur at least. Anybody? Anybody? I think I heard the answer. Somebody said that. Somebody said the answer here. Huh? Nobody. Anybody? The question is, there's a legislation, provision of legislative support. That means provision in the assembly to health protection and promotion. Can you give an example? There's an example sitting. No, not PPP model. In fact, he's given an answer, but he's unaware of the fact that something is very close to him, which is an example of, not example, as an outcome of the legislative support. Can you say what it is? Huh? Somebody's got this. Somebody's got this. What is this for? Who's this? It's a car. This guy is. What's your name? The name?
Sari Sarjam Mandi.
Okay. So, he's a good boy. He's wearing the helmet. Why? Because a helmet protection is provided by the government. Okay. You should wear helmets. But majority of people in Bolpur are not wearing it. Cholche cholve. So, he's a very good boy. He's following the rules. Okay. That is an example of protection of provisional legislative support to health protection and promotion. Why is helmet important? It protects you from head injuries. Okay. Then concerned actions to combat widespread malnutrition, like use of ORS, etc. And midday meal scheme is another one. School health program is another one. Research an alternative method of healthcare delivery and low-cost health technology. So, alternative method of healthcare, there is a big statement, but nothing really came out of it. Huh? Okay. Now, then the first one is 1983. Right? 2001 again they found that a lot of gaps were there. They started something more. So here they said the main objective is to achieve acceptable standard of good health among general population. Okay. So after 1983, next one was in 2001. So then 2001 was very specific. They had certain things, diseases to eradicate and to control. So some of the diseases were eradicate polio and yaws by the year 2005, eliminate leprosy by the year 2005, eliminate Kala Azar by the year 2010, eliminate lymphatic filariasis by 2015, achieve zero growth of HIV by 2007, reduce mortality by 50% on account of TB and malaria by 2010. So these were the goals which were there in the 2001 policy. The previous one was rather vague. There was no milestone. This particular target was there. Within a certain time frame. Eradicate polio, deadline was 2005. Leprosy, 2005. Eliminate, by the way, one important question. What is eliminate, what is eradicate? Examiner will ask you what is eliminate, what is eradicate. Eradicate manatake. What is eradicate, what is eliminate? What is the difference between eliminate and eradicate? Eliminate and eradicate, what is the difference? Eliminate one? What is the difference? Anybody? Eradicate means not a single case should be there. Okay. Eliminate means it is brought to extent where it is no longer a public health problem. Maybe one or two cases here or there, but it's not enough to create a major health problem. Eradicate means not a single case is there. Okay. Then some other things was there, like vector-borne and waterborne prevalence disease and prevalence of blindness brought to 0.5, reduce IMR to 30, MMR to 100 by 2010, improve nutrition, reduce low birth weight babies from 30% to 10% by 2010, increase utilization of public health facilities from current 20% to around about less than 75% by 2010. So this current use of public health facility, okay, I mean utilization of public health facility, what was the meaning actually? So what was the reason for this? Public health facility and the less usage of public health facility. What could be the reason? What could be the reason for this? Utilization of public health facilities below 30%, below 20%. Why? Why was it below 20%? Why was it below 20%? Why was it below 20%? Anybody? Let me ask a random question to some random people. If you were fall sick in your house, anywhere, I don't know where your house is, where would you go? I'm asking you. Which doctor would you go to if you fall sick? Or which hospital would you go to? If you fall sick, where would you go to? Huh? No, not because you're here. Suppose you're in your place. But where would you go to? Would you go to public health facility? Would you go to government college, government medical college? Would you go to government hospital? Yes or no? No. Why no? Why no? I just want to know. Why no?
Because public is convenient.
Public is convenient. So you go to public.
Private is convenient.
She's saying private is convenient. So she's not going to the public because private is convenient. Do you agree? She's saying that she won't go to the public if from her house. Okay. Because private is convenient. So what do you say? Same. So even if you pay money, you would rather go to a private place, right? And another reason is that private place you're paying money, so you might get better services, maybe more neat and clean, etc. So that's why people were going to the public place. So to improve that, you need to improve the hospital setup. Okay. So that is why the increased utilization of public health facilities from 20% to 75% by 2010. And establish an integrated system of surveillance. So what do you mean by surveillance? What is the general meaning of surveillance? What do you mean by surveillance? What is surveillance? Surveillance means what? What is surveillance? General meaning of surveillance. Huh? Keeping a watch, very good. Keeping a watch on things, okay. So keeping a watch on things. Like for example, you know the rainy season is there, so going to come. So you are enhancing surveillance, you are increasing surveillance. What? Waterborne diseases, malaria, etc., etc. So they establish an integrated system of surveillance, which is called IDS. Then again, after 2001, next one came in 2017. Improve health status through concerted policy actions in all sectors, expand promotive, preventive, promotive, curative, palliative and rehabilitative services provided through the public health sector with focus on quality. Now, there are three terms that you've heard: preventive, promotive and curative. You prevent a disease, you promote good health and you cure the disease. But the next two terms, palliative. What is palliative? What is palliative? What is the meaning of palliative? What is the meaning of palliative? Huh? What is palliative? What does the word palliative mean? Okay, specialized treatment to advanced cases people who are in a terminal disease, like somebody suffering cancer, you cannot do anything further, but you are giving him the specialized treatment. Okay, well, he's really being relieved from pain and all. He's not given newer mononuclear antibodies and all. He knows he's got multiple metastases, Bajbena. So you are giving him service, not that you are throwing him away. Same thing in rehabilitative services. If somebody's got an accident or something else, they are trying to put him back onto his feet. Okay, with focus on quality. The most important thing is the focus on quality. This was in 2017. Here again, some more things came. Increased life expectancy from 67.5 to 70. Established DALI index as a measure of burden of disease by 2022. Reduction of total fertility rate by 2.1 at national subnational level by 2025 and reduce under 5 mortality 23 by 25. Okay. So the goals were revised again in the year 2017. Again, some more are there. Reduce infant mortality to 28 by 2019. Reduce neonatal mortality to 16 and stillbirth rate to single digit by 2025. Achieve and maintain elimination status of leprosy by 2018. Kala Azar by 2017. Lymphatic filariasis in endemic pockets by 2017. Achieve global target of 2020, which is also targeted for HIV/AIDS. As after 2020, HIV should no longer be a problem. These were some of the criteria which were goals to be achieved in the new health policy in 2017. National Health Policy 2017. These are some of the goals to be achieved. Not only that, some other things like, for example, TB. To maintain a cure rate of over 85% in new sputum positive cases and reduce incidence of new cases to reach elimination status by 2025. To reduce the prevalence of blindness by 0.25 by 2025. To reduce premature mortality from cardiovascular disease by cancer, etc. by 25%. And increase utilization of public health facilities by 50%. Antenatal coverage to be sustainable. Some more than 90% of newborns should be immunized by 2025. Meet need of family planning about 90% at national level by 2025. And control the hypertension. 80% of the people should be controlled. Relative reduction in prevalence of current tobacco use by 30%. And reduction in prevalence in stunting in under 5 children by 2025. So these were the goals of the 2017 program, 17 National Health Program. And also a new one was the Swachh Bharat Abhiyan, safe water and sanitation. Though it was not directly related to health, it is linked. Without safe water and sanitation, full health is not possible. Reduction of occupational injuries, increase health expenditure from 1.15 to 2.5%, increase states health sector spending to more than 8%, and decrease in proportion of households facing catastrophic health expenditure. What do we mean by catastrophic expenditure? What do we mean by catastrophic? What is the meaning of catastrophic? What is the meaning of catastrophic? Hold on. Huh? Catastrophic is destructive, something, okay, fine, yeah, destructive. So you have heavy expenditure which the family cannot withstand. So suppose somebody's got cancer. He has to buy all his medicines. Where will he get the medicines? Or somebody's got to go on dialysis twice a week. Where is that coming from? So it is going beyond the means of the average person. Okay. So these were some of the goals which were there in the 2017 health plan. Again, ensure availability of paramedics and doctors as per Indian public health norms. Establish primary and secondary care facility in high priority districts by 2025. Ensure district level electronic database. See, till 2015 or so, there was never any computer installed in the primary health center and all. After that, the computers and all came. So ensure district level electronic database of information health system by 2020. Strengthen the health surveillance system by 2020. This was the national health policy in 2017. Do you think that this has been achieved? Do you think that this has been achieved? 2017 we had these goals, but do you think this has been achieved? Number one. Number two, if it has not been achieved, why so? Very simple question. Tell me yes, it has been achieved. If it has not been achieved, tell me why it has not been achieved. Has the government fulfilled achieved the targets within the stipulated time? Huh? In reduce infant mortality to 28 by 2019. Reduce neonatal mortality by 2025. Has it been achieved or not? Has it been achieved or not? What is your opinion? Slightly tricky. Okay. After this, I'll give you one more clue. Okay. Increase life expectancy to 67.5 to 70 by 2025. So, has this been achieved? Has it been achieved? Did something else come in between? Did something else come in between to create some problems? What? Bolo. You know it. 2017, the government set some policy. They are asking for reduction by 2025. Between 2017 and 2025, what happened? Something major happened? Something major happened in 2017 2025 affecting health? COVID, yes, exactly, COVID. So the appearance of COVID brought a prolongation of all the deadlines. Because of COVID, all these deadlines got postponed. Okay. So this was proposed by 2017, but unfortunately, because of COVID, we could not do much. Many of the targets remain unfulfilled. So this is another thing. Swachh Bharat Abhiyan as part of the environment health, balanced healthy diet, regular exercise, addressing tobacco, alcohol and substance abuse, Yatri Suraksha preventing deaths due to rail and road traffic accidents, and Nirbhaya Nari, action against gender violence. So these are the 7 priority areas for improving the environment for health. Now, from here, we move on to the Planning Commission and the health plans. This was after independence. The government started this National Health, Planning Commission. Okay. So their main thing was to make plans for the country every 5 years. So they would start with include not only health, other departments also. So among health, the thing was control and eradication of various communicable disease, deficiency disease and chronic disease, strengthening of medical and basic health services by establishing health units, PHCs and subcenter, population control, development of health power and health manpower and research, and development of indigenous system of medicine. Okay. So all these came under the 5-year plan. So let's go to the first one. The first 5-year plan was 51 to 56. So the aim was to fight disease, malnutrition, unhealthy environment, and build health services for rural population. What are the priorities? Mind you, 1951. Safe drinking water, health services for mother and children, family planning and population control, and also control of malaria. So that is the priorities. Safe drinking water, health services, family planning and control of malaria. What developed? What are developments? BCG vaccination was started in 1950. PHCs were set up. ANMs were started. National Malaria Program was started. Prevention of Food Adulteration Act was done. And the minimum age of marriage, 18 years for boys and 15 years for girls, was prescribed by the Hindu Marriage Act. So these are the priorities and the development. What happened? Sometimes you have priorities, but in that 5 years, you cannot do everything. So they did what they did. They got a BCG vaccination roll-off, PHC set up in rural areas, ANMs were started, National Malaria Program was launched, prevention of food adulteration, minimum age of marriage was also prescribed. Second 5-year plan was, obviously after 56, to bring existing health services to within the reach of all people so as to promote progressive improvement of the nation's health. So priorities was establishment of institutional facilities for rural as well as urban population, development of technical manpower, control of communicable disease, family planning and other supporting programs. So here what was the development? Demographic research centers were established, that is to study the population. National Malaria Control Program was converted to National Malaria Eradication Program. The previous one was National Malaria Control Program. Then they said, let's make it Eradication Program. Panchayati Raj was introduced. What is the importance of Panchayati Raj? Panchayati Raj means the Panchayat has got the money, the power to allocate funds and do things. It does not have to wait for the state or the district. Okay. And School Health Committee was appointed by the Ministry of Health. This was the second 5-year plan. The third one was to remove the shortages and deficiencies which were observed. Here again, safe water supply and expansion of institutional facilities to promote accessibility. Now, during the course of this, government also started All India Institute of Medical Science, the first 5-year plan, okay, and various other organizations also. National Institute of Mental Health, Bangalore was started. JIPMER was there also. Strengthening of upgrading of existing health centers, provision of ambulance services for emergency medical care. BCG vaccine without tuberculin test was introduced on house basis. Bill on registration of births and deaths. So till 61, people did not know births and deaths, what is going to be happening. So it was raised only on that the third 5-year plan. They started this bill on births and deaths, and applied nutrition program was also started in the same 5-year plan. Then came the fourth one. Again, the aim was to strengthen the PHC network and for understanding preventive and curative and family planning services. Here again, 69 to 74. This is a year in which the population grew a lot. Family planning program was started. Strengthening of primary health center. Intensification of the control program. Then they started the National Institute of Nutrition. Then the Central Birth and Death Registration Act was promulgated. Population Council of India was set up. All India Hospital Family Planning Program was also started. Okay. So 69 to 74, the main focus was on family planning and establishment of primary health centers. This was the main thing. Then the fifth one was 74 to 79. Again, health services, maternal and child health services, family planning. Here again the priorities were increasing accessibility to health services in rural areas, integration of health, family planning and nutrition, and improvement in the education and training of health personnel. Now, till 74, people were not getting trained, So some nurse comes, she's just appointed, but she's not being trained. So training of nurses was an important thing. Child development scheme was launched. Child welfare board was set up. Child marriage restraint was set there. And Alma-Ata declared the primary health care strategy. Alma-Ata is a place in Kazakhstan, where the where the World Health Assembly had its meet. Sixth one was again to accessible to living rural health, particularly to those living in tribal and hilly areas. So till then we thought rural area means everything, but a person sitting in the tribal hills, he is not getting any help because doctors are not going there. Similarly in the tribal areas, doctors refuse to work there. So focus was on tribal and hilly areas, rural health services, development of rural and urban hospital, population control and family welfare, and there was also census which was done in 1981. National health policy was announced, 20-point program was announced, and National Guinea worm eradication program was started. This was the sixth plan. Seventh plan, again priorities were health services in rural and hilly areas, MCH and family welfare, standardization and integration application of Indian system of medicine. So this is the first time in 1985, the focus came on slightly on the Indian system of medicine. Till then we thought Ayurveda is nothing, Ayush is nothing. 1985 was the first time that they said that think also of the Indian system, alternative system of medicines. Development's Universal Immunization Program was launched. Juvenile Justice Act was started. Safe Motherhood campaign was started. And ESI Act also came into force. So 1985-90, the Universal Immunization Program started. Safe Motherhood and also the ESI Act came into force. So then came the 8th 5-year plan. This was aim was to again same thing, developing rural health infrastructure, control of communicable disease, universal immunization. Another topic here was medical research. So that's the time when they started this Indian Council of Medical Research was started on this time in a big way. And developments where CSSM program was started, Child Safe Survival and Safe Motherhood. And ICDS was changed to Integrated Mother and Child Development Services, and the first pulse polio for program under 3 years, and family planning was made target free. So what do we mean by family planning was made target free? Previously, in the district they would say, okay, you have so many couples, you have to do so many ligations, so many operations. So instead of that, there's no target. It is a bottoms-up approach. So nobody would say that Birbhum district needs 1,000 ligations per year or something like that. So the target free, that is what is meant by target free. Previously it was that Birbhum has got a population of so much, so you must have 1,000 ligations. Murshidabad has got a population of so much, so Murshidabad needs 2,000 ligations. So that target is now no longer there. Target free. Then 9th 5-year plan, control of communicable and non-communicable disease. Improvement of referral linkage. What do we mean by referral linkage? Means a patient is coming for treatment, he is not getting the facilities here, he has to be referred to a higher center. So that patient should be referred to either district hospital or subdivision hospital or medical college or whatever. That is called referral linkage. Along with that, disaster and emergency management. That also came under the 9th 5-year plan. And involvement of practitioners from indigenous system of medicine. Indigenous system means Unani, etc. Ayurveda, Unani, etc. Developments again, RCH program was launched, and the government started the national population policy, and the national health survey was undertaken. The 10th 5-year plan, upgrade the skills of health personnel, improvement the quality of RCH, carry out research on nutritional deficiencies, and again, these are some of the developments. Reduction of poverty ratio, all children in school by 2003, all children to complete 5 years by 2007, increase in literary rates to 75%, reduction of IMR to 45 and 28 by 2007 and 28 by 2012. These were the goals of the 10th 5-year plan. The 11th 5-year plan was, again the goals were reduce the MMR further to 1, reduce IMR to 28, reduce total fertility rate to 2.1, reduce malnutrition, and here the developments were improving health quality, improving survival. The third point which was started, mind you, 2007 to 2012, e-health. The first time the word e-health was there. Okay, so that means you could use your mobile or you could use your internet for knowing your health things, status. Focusing on excluded or neglected areas and enhancing effects at disease reduction. This was the 11th 5-year plan. And the 12th 5-year plan, which was also last 5-year plan, objectives was faster, more inclusive, sustainable growth, could aim at 9 to 9.5%, faster creation of jobs, better performance in agriculture, stronger effects in health, education, infrastructure. So then came the NITI Aayog. So after the 12th 5-year plan, the Planning Commission ceased to function. It was replaced by NITI. NITI is, the full form is National Institution for Transforming India. Okay, so NITI Aayog is National Information for Transforming India. That is the full form of NITI Aayog. So this was started in the year 2015. Okay, January 1st, 2015. It's a government, this is a short note which will come in the exam. What is NITI Aayog? Or what is in the orals? What is NITI Aayog? Okay, so NITI is nothing to do with law. What its full form is? National Institution for Transforming India, and is formed in 2015. It's basically a think tank of India's development. So all the experts are there, whether health, economics, finance, etc. Everybody is there. And the important thing about NITI Aayog is that it brings in cooperative federalism. What do I mean by cooperative federalism? Any idea? What is cooperative federalism? Big word. Cooperative federalism. What does it mean by cooperative federalism? Any idea? Anybody is good in English, bit good in English, reads a lot of. How many of you read novels in English? How many of you read novels in English? How many of you read novels? English? Raise your hands. Nobody? Acha, anyway. So what is cooperative federalism? What is cooperative and what is federalism? You look at the break of the words. What is cooperative? Tell me. Bolo. Aapas mein. Okay. Between them. Cooperative means aapas mein. Fine. Between among them. What is federalism? What is federalism? Huh? Yeah, okay. Now he's come to the point. Cooperative federalism. So he's saying cooperative means you cooperate with each other. Federalism means different states. Now what is happening is a state with a larger population, they'll say, I want more funds. Okay. A state with a small population, they say, you will get only 1 lakh rupees or 1 crore rupees. A state like West Bengal will say, you give me 10 crores. Maharashtra will say, give me 20 crores. So that is what is cooperative federalism. So different states will have different demands. I want so much money. I want 10,000 crores because the cyclone has hit my state. Another state says, no cyclone, but my state is poor, so you give me the same 10,000 rupees, 10,000 power thing. So that is called cooperative federalism. So this is one of the things which has regularly been happening over the years. Always places like West Bengal, Bihar, they always say that the center is neglecting us. We don't get the money we want. So that is the thing, cooperative federalism. So here what happens is, it represents the economic interest of state governments, and union territories of India, which the previous planning structure commissions lacked. So here what happens is that the NITI Aayog also has representatives of the state government. And it provides, instead of it being in a controlling seat, it is going to be a provider of both directional and policy inputs. And it provides public access to articles, fields, reports as well as published opinions. So this is the present members. Just look at the last point. First is Prime Minister, obviously. These are the other members. Governing Council consists of all Chief Ministers and Lieutenant Governors of Union Territories. That means all Chief Ministers are part of the NITI Aayog. So the state has got a say. It is not that the center will say, I am giving you 50 crores. The state will also say, I want 45 crores or I want 100 crores. That is why governing council, all chief minister and lieutenant governors of union territories are there. So the role is to evolve a shared vision of national development with the active involvement of states. Okay. So you need the states' feedback also. Somebody sitting in Delhi will not be able to tell you how much money is required for development in, say, Birbhum. But the Chief Minister of West Bengal or his representative will be able to tell you how much money is needed for, say, Birbhum or, say, Midnapur during floods, etc. That is why to develop credible plans at the village level and aggregate this at higher levels, and to foster cooperative federalism with the states on a continuous basis, recognizing that strong states make a strong nation. Okay. So this word is important, cooperative federalism. As your friend said, cooperative means you're cooperating with your other people. Federalism means different states have different criteria. So a state like Goa with a small population cannot have the same thing as West Bengal with a much higher population. And here again, to focus on technology upgradation, implementation of programs and initiatives, to encourage partnerships between national and international like-minded think tanks, to create innovation, and to pay special attention to the sections of society that may not be benefiting from economic progress. So basically, the whole thing is, we are seeing the NITI Aayog's progress. There's no 5-year plan after the 12th 5-year plan. But the important thing is the government, the state governments also there. So the area activities are policy and program framework, cooperative federalism, monitoring and evaluation, think tank, knowledge and innovation hub. So you have people from various fields, health sector, economic sector, management sector, legal sector, all of them are in the NITI Aayog. Okay. So here the Prime Minister is the chairperson, governing council comprises chief ministers and governors of union territories. Regional councils will also be formed to address specific issues impacting more than one state, and they will be formed for a specific tenure, and it will be comprised of chief minister of states and lieutenant governors. And here you also have experts, specialists and practitioners with relevant domain knowledge. Suppose, for example, somebody is there who's got a lot of knowledge about earthquakes or floods. He can be put in. Somebody who's got a knowledge of the health system, he can be called in. Very expert, okay. So this is the same thing. The chairman is the Prime Minister, Vice Chairman is to be appointed by Prime Minister, members full-time, part-time members, ex officio members, Chief Executive Officer and Secretariat as deemed necessary. Functions are that it works out a common vision of national development, follows bottoms-up approach. That is, bottoms-up approach means the lower part decides what is there, instead of something coming from above. It's not that if I, for example, I ask, 140 students are here in the class. I order 140, I order lunch for you. I say 140 packets of biryani. Okay. That is called top-down approach. I am giving the orders. Instead of that, I ask you, 50 of you all say I want pizza, another 50 say I want biryani, another 50 say they want something else. So that is called a bottoms-up approach. Okay, just a small example. Promote partnership between important stakeholders, create innovative, entrepreneurial and knowledge-based support system, maintain high-level resource center, focus on capacity building, act as center platform for solving issues between different departments. So the difference between planning committee and planning commission NITI Aayog, the first is, here there was a planning commission enjoyed powers to allocate funds. Here it is a advisory body, a think tank. Here it was only, the rule was limited to only annual interactions during plan meeting. So the plan was for 5 years, so the planning commission would probably meet twice in 5 years. But here it plays, states play a big role. And here they had full-time members, but the number may vary in NITI Aayog. And member secretaries appointed through usual process. They also had part-time members in the NITI Aayog, but not in this. Okay, so this is the main difference. And this is achievements of NITI Aayog. After NITI Aayog came, we had this Ayushman Bharat and Health and Outcome Index, Aspirational District Program, reforms in the Medical Council of India, which we are seeing, which you people are also seeing, like this ADCOM and other things. Reforms in Homeopathic Central Council, review of social marketing schemes, tracking performances of district hospitals, and development of public health cadre. So these are the achievements of the NITI Aayog after 2017, which is when the last 5-year plan came. Okay. So the main difference is that financial clout, state's role, and approach strategy. Here it is a bottoms-up approach. That's the right side is the bottoms-up approach of the NITI Aayog. Okay.